Let's discuss about the cost of breast implant surgery. Hi, I am Dr. Hiranmayi Jha. I am an aesthetic plastic surgeon practicing at Eternal Vision, an aesthetic clinic located at Shivalik, Malvi Nagar. And today we'll be discussing about what are the costs of breast implant surgery or breast augmentation surgery. So basically we are discussing about the implant based or silicone implant based breast augmentation costs. So coming to the fact that first you have to consult your plastic surgeon and discuss about the various sizes of breast implants that are required for you, and then the question that comes to our mind is what is the cost of it and how much money is required when we are going for breast implant surgery in Delhi. So the cost which is there for a breast implant surgery comprises of 2 to 3 things in it. Number 1 is the cost of the implant which is needed to be placed. Number 2 is the cost of the hospital in which the surgery is to be done. And number 3 is the duration of days that is required to be there, which decides what is the cost of your surgery. Now coming to the breast implants, there are a few standard companies which are US FDA approved and their costs are standard. Okay, so while you are going to choose your implant, you have to keep in mind that almost ₹1 lakh is required to buy these implants. So the surgery cost accordingly varies. Now coming to the hospital, the facility in which your surgery is being done and the surgeon who is doing it. So normally according to the experience of the surgeon cost is almost fixed, and hospital in which we are doing. So suppose you are going to a corporate hospital in a first tier city, the cost is more compared to a hospital in which is located in a B tier cities. So there your cost is lesser. Now the duration of the surgery. So almost there's a fixed duration of the surgery. 2 to 2.5 hours is the standard duration which is required for a breast implant surgery, and if done under great expertise and if done meticulously, so accordingly the OT costs adds and the anesthesia fees is added accordingly. Now what are other factors which adds to the cost is the duration of your stay. Suppose it's sometimes you can be discharged even on a daycare basis. If you are insisting, your surgeon might discharge you the same day also after an observation of 6 hours post surgery. So their cost is lesser. But suppose if you have to stay in the hospital overnight, or if you need to stay in the hospital for 2 days, 3 days, so now your cost adds. So basically for a breast augmentation surgery to be done with a Motiva, which is a standard implant, US FDA approved, and if you are getting all these done, the cost varies from the minimum cost that is required is somewhere around 1.5 to 1.75 lakhs to 2 to 2.5 lakhs in Delhi, and accordingly the cost might increase depending on the facilities that you are using, depending on the surgeon who is doing it, and depending on your comorbidities, if any. Suppose if there are other extra cares that needs to be done, then your cost might add. And there are other factors also which increases the cost, like your imaging, that before you're going for a breast implant surgery, mammography, sonomammography is a must, and then that might lead to adding to your cost of your surgery. Now again, if you have already a breast implant in situ and you need a replacement of your breast implant, in those scenarios breast MRI is a must, that thoroughly goes and checks your what is the milieu of your breast, and then a replacement might be needed in which the existing implant is removed and a new implant is placed and it can all be done in the same sitting. So these are the various factors which add to the cost, and these are the various ways by which you can decide that how much money is required while you are planning your breast augmentation surgery. Thanks for watching, and if you have any queries, please write to us in the comment section below. Thank you.